In today's healthcare landscape, the repercussions of noncompliance with regulations are more significant than ever. Beyond the criminal and civil penalties, the long-term impact on an organization's reputation and operational capacity can be profound. This episode delves into the complex world of healthcare compliance, highlighting the consequences of non-adherence to regulations. We'll explore the legal frameworks governing healthcare, the financial implications of violations, and the broader effects on patient trust and safety. Through expert insights and real-world examples, we aim to shed light on the importance of a robust compliance program and the potential devastating costs of noncompliance. Whether you're a healthcare professional, a compliance officer, or simply interested in the mechanics of healthcare regulation, this episode offers a comprehensive overview of what's at stake when healthcare operations fails to comply. Welcome to the Compliance Leadership Lounge. I'm Ross Ronan, your guide for insightful discussions in healthcare compliance. In our lounge, leaders and experts gather together to share their perspectives and wisdom. So grab a chair, make yourself comfortable, and join the conversation as we dive into the strategies and stories behind effective compliance leadership. Whether you're a CEO, board member, or a compliance enthusiast, you're in the right place to learn, grow, and lead with integrity. Welcome to the Compliance Leadership Lounge. Today's episode is the cost of noncompliance, legal and financial implications. We appreciate you being here to talk about the critical importance of compliance and avoiding the legal and financial pitfalls. One of the most famous quotes we use in the compliance program all the time is from U.S. Deputy AG Paul McNulty. If you think compliance is expensive, try non-compliance. The stakes in healthcare compliance is extremely high. When we talk about the healthcare laws and regulations that we all must navigate in healthcare, it is one of the most highly regulated industries, right next to financial, airline, anything that has an abundance of regulations due to misconduct, due to people breaking the law, and a lot of regulations having to go into place. Now, when we talk about healthcare compliance, 9 times out of 10, we're talking about the federal healthcare program like Medicare, Medicaid, TRICARE, CHAMPUS. Why is that? Well, those are funds that we are all putting into and have been for many years that can run out. The government will tell you oftentimes that there's not an endless amount of money in these to take care of everybody 65 and older, or from the state standpoint, everybody who's impoverished. So when we have to look at it from a fraud, waste, and abuse standpoint, it's really protecting that financial trust fund of money out there that is expected to take care of people long term. We all give to it, we all contribute to it in some way, shape, or form, and that's where fraud, waste, and abuse comes out. With that, you get a bunch of regulations. And those regulations, although vast, depending on which type of healthcare that you're doing, 9 times out of 10, they fall down to 2 regulations, in my opinion, as a compliance officer, that we deal with most often. The False Claims Act is number 1. That is knowingly or unknowingly causing a claim to be submitted to the federal government that you shouldn't have received, essentially. I'm paraphrasing what the regulation says because it's long and it's lengthy, but it's something of that nature. The penalties right now, I think with inflation, are a little under $14,000 to a little almost $28,000 in penalties. You can also get 3 times the damages, which they also refer to as treble damages. And finally, potential exclusion. When we talk about healthcare companies, healthcare organizations, unless you're doing something like voluntary work like plastic surgery or something that is cash-based business, 9 times out of 10, you're going to take 30 to 40 to 50% of a government payer, whether it's Medicare, Medicaid, TRICARE, or CHAMPUS. That is going to really put you into a position if you get excluded from the federal healthcare program. The Office of the Inspector General has the rights, permissive and mandatory exclusionary authority to remove somebody from the federal healthcare programs, i.e. meaning that they cannot practice, they cannot participate, they cannot see Medicare beneficiaries and receive payment from them. More importantly, is anybody who's an employer organization cannot contract with anybody who has been excluded from the federal or state healthcare programs that may cause them to submit a claim in error. I've seen this be very expansive where the exclusion authority has applied to someone who hasn't even worked at a location in 3 years, but that organization forgot to take them off of their enrollment, their documents, their corporate documents. The government came back, especially the enrollment areas of CMS came back and said, hey, by the way, they're still on your list. They're still on your roster. They're still listed as your medical director. Therefore, we're going to terminate your provider number because that individual has been excluded. That can be a huge damning type of penalty associated with a False Claims Act. The second one, in my opinion, is the Anti-Kickback Statute. Those two are the biggest ones we see the enforcement actions on. There's other ones like Stark and HIPAA and EMTALA that have some weight behind them. But the biggest ones that we see are the False Claims Act and the Anti-Kickback Statute. On the Anti-Kickback Statute, there are criminal penalties, there are civil monetary penalties up to $50,000 per violation per issue, and they can tack on false claims acts to those. For example, the Anti-Kickback Statute is you shall not pay anything of value in exchange for the volume or value of referrals, i.e. I can't pay somebody to refer Medicare and Medicaid patients to me and give them essentially a kickback. That's what it really refers to. So when someone gets in trouble for the Anti-Kickback Statute, not only that civil monetary penalties can be enacted, criminal penalties go to jail, but every claim that has been billed to the federal health care program as a result of a kickback arrangement can be subject to a False Claims Act penalties. And if you go back to that, it's $14,000 to $28,000 per penalty per claim, 3 times treble damages. So that means if you overbilled Medicare $1 million, they can come back to you for 3 in addition to those penalties. Then finally, they can exclude you for either one of those, and that means you're not participating in the federal health care program. I've been a part of lots of organizations over the years and lots of corporate integrity agreements. So part of that is really participating with a few False Claims Act investigations, Anti-Kickback Statute investigations as well. And we've had a lot of significant consequences over the years and lots of money being paid due to the fact that there wasn't good compliance efforts done up front when you purchase an organization or you bring them underneath your umbrella or you're just setting up your program. But there are a lot of different consequences that can affect and can take place. Like I said, when you have somebody who's still on your roster who has been excluded from the federal health care program in another life, but you just forget to take them off of your enrollment forms, that can affect you too. At some point in time, that was $3 to $4 million of lost revenue just because Medicare said, you didn't clean up your stuff, we're removing your provider number. I know you kept seeing our patients, but too bad, you're not getting this money. And there's been a lot of different consequences related to those. I'd highly recommend anybody going on the OIG website. I do it every day. I look at the exclusions and the enforcement actions that are going on, whether it's False Claims Act, Anti-Kickback, civil monetary penalties, any of those, you can read what is going on. Let's talk a little bit more about statistics when we say, what really happens. What are the consequences? What are the high risks of these issues? When we look at the OIG's semi-annual report to Congress, and this was from fiscal year 2023, covers between October of 22 to September of 2023. That's their fiscal year. They're reporting an expected audit recoveries of $284 million. $284 million they're going to expect to get in just auditing, not penalties, not investigations, just by doing audits. They expect to receive almost a little bit over $280 million. In expected investigative recoveries, which means that there's an issue with a False Claims Act, someone's made a complaint, somebody's had an issue with this organization from the Anti-Kickback Statute, they're projecting that it's $3.16 billion. Of that, $2.6 billion is coming from False Claims Act. Quite a big statistic. It's like 90%-ish is coming from False Claims Act out of the entire enforcement. And of that, $2.3 billion is coming from key TAMs. Key TAMs are whistleblowers. People who know something because a company is not doing the right thing. They go in and they whistleblow, they go communicate with the government because they continually told an organization who probably doesn't have a compliance program that they're continually doing wrong. Sometimes there is compliance programs associated with qui tam actions. Those individuals, I just saw one the other day, where the compliance officer got pulled in as a defendant and went to jail as well and is actually paying back some monetary penalties. Of that $3.16 billion of potential investigative recoveries, $2.3 billion of that is coming from qui tams. They did about 707 enforcement actions, criminal enforcement actions. So 707 people went to jail in some way, shape, or form. They did 746 civil actions, i.e. getting money for those penalties. I went over those penalties a second ago. They had 2,112 exclusions. That means there's 2,112 people who may not participate in the federal health care program, and 9 times out of 10, they are not going to be able to be employed in health care. As a compliance officer, I will tell you, and I advise this all the time of any client that I have or my previous companies, if an individual, whether it's a practitioner, whether it's an administrative assistant, whether it is a support service, whether it is janitorial services, I don't really care, or a company that we have a vendor agreement with, if anybody is excluded on that, there is no reason to take the risk. That person has done something wrong, and therefore they need to either A, clear it up with the OIG if they wrongfully feel like they are not included, or B, they need to go work in another field other than healthcare. We look at HHS and we look at their enforcement actions that they reported. We have the Office of the Inspector General, which is under Health and Human Services. But if we look at their enforcement actions for just the Health and Human Services across the board, they had 1.8 billion settlements. And of that 1.8 billion settlements just in healthcare, they're looking at 1.6 billion of those in qui tams. If you do the math, that's about 442 judgments and settlements they had during 2022 or during 2023. That comes out to be a little over $4 million per settlement. $4 million per settlement is a lot of money. Now, I've seen them range anywhere from 60, 70, 80,000 to 20, 30, 40, $100 million. You can see these on the OIG website. But if we're averaging them out to be about $4 million, think about the compliance versus non-compliance cost of that. It doesn't even mention the criminal offenses associated with it. Now, putting all that to perspective, right, we talked a little bit about how much money we're talking about. $3.16 billion in investigative recoveries, $284 million in audit repayments, 2.6 related to False Claims Act matters, 2.3 related to qui tam matters. Healthcare Compliance Association does a salary survey or does a compliance department survey. And we use this as a functional tool to say what, on the average, are people spending in healthcare for compliance programs. So some of their numbers that they came out in 2022 survey came out in 2023, is that they indicated that if a company has a revenue of less than $500 million, one, they have anywhere between 1 and 5 compliance employees. That is the most often, majority of companies less than $500 million in revenue have at least 1 to 5 individuals. None of them have, very little, if anything, have 0. If we even get more microscopic, if you will, into this, a less than $5 million company, which is a pretty small company in healthcare if you look at it, 39% of those have 1, and 30% of those have 2 to 5. So 65% have between 1 and 5, and someone who's less than $5 million, a company who's less than $5 million in revenue. So we look at what they're doing across the company and across healthcare is even the smaller organizations, less than $5 million in revenue, or the moderate-sized ones, $500 million or less. Once you get into the billions, they obviously have many multiple compliance individuals, but on the average, we all know that, and they've committed to funding their compliance programs. When we talk about those smaller numbers, They're even putting more emphasis on compliance by putting these individuals in there. So what does that mean from the standpoint of an employee volume size? So if you have more than 5,000 employees, or you have less than 5,000 employees, we saw that 65 to 85% of those have 1 to 5 compliance individuals. Getting more granular, less than 100 employees have an average of 47% at least have one compliance person, the compliance officer, and 39% have between 2 and 5. So that's an 86% combined between 1 and 5 for anybody who has less than 100 employees. So that's a pretty small company as well. Let's talk about dollars. And dollars, when I mean dollars, I mean compliance program dollars. How much does it cost to have a compliance program? When this whole thing started out with, if you think the cost of if the cost of compliance is expensive, try non-compliance. This is how we're going to tie that together. So HCCA reports that if you have $15 to $50 million in revenue, the average is about 35% of those that are in between 15 and 50 million, 15 to 50 million dollars in revenue, that they have an annual budget between $100,000 and $499,000, so a little less than half a million dollars. When we look at the 100,000, most of those companies that are less than 5,000 employees may have a fractional individual in the compliance program that gets you to about that $100,000 range. But just to say they've invested between 100 and $500,000 in their compliance program for 5,000 employees or less. When you look at revenue, when you look at an annual revenue between $50 and $500 million, we look at between 38 and 40% of those programs have a minimum budget of $250,000 up to $1 million. So between 50 and 500 million in revenue, between $250,000 and $1 million in their compliance budget. That's how much they have invested in their compliance program. What we see when we come in and we put together a compliance program at our company or stand in as their compliance officer, one of the things that we do is put in a compliance budget, because I think it's really important, and I talk about this a lot with our compliance officers and clients, is even if you haven't budgeted a compliance program, some companies don't like to do that. Some companies like to roll it into risk, quality, budget. Legal is a big one where they roll it into legal, and they don't really want to line item out compliance. Fine, doesn't really matter. But I tell every compliance officer that I mentor, that I lead, that I train, that I teach, go ahead and create one, whether the company asks you for one or not, because you should know what the company is spending on your compliance program. Plus, if the OIG or DOJ or anybody comes in and says, prove to me you have an effective compliance program, you can go, this is what we spend and this is how we take care of it and this is how the company supports us. We see on the average spend between $185,000 and about $250,000 for an effective compliance program for a smaller type of organization, $500 million or less, 5,000 employees or less. Sometimes that $250,000 range, you'll get up to another employee or so, but most of the time it's between 1 and 2 employees that are able to run it. That way you can do it very effectively if you're using outsourced resources, outsourced hotline, outsourced audit tools. So when you're looking at this as leadership, as your CEO, as your boards, and you're putting into these compliance programs, really thinking that I can get away, depending on my level of revenue within this organization, for a compliance program to cost me between $150,000, $180,000 to $250,000, $300,000, that's about the right lane that you need to invest in to have a functioning compliance program. Obviously, the more issues you have, the more stuff comes up, the more you're going to end up spending, but you'll be able to gauge that once there's a compliance program in place. So let's tie that back to the average exposure and penalty for not having a compliance program. If the average recovery is about $4 million across the industry in healthcare, and there's $3.16 billion being recovered, And we've seen exposures anywhere from $70,000 to $80,000 up to tens of millions of dollars. An investment of $185 to $250 will pay off pretty quickly, because once you have one settlement, once you have one issue and then don't put in a compliance program, you're going to have another, and you're going to have another, and you're going to have another. So doing it up front also saves the money that you've earned as a company, as a CEO, as a board, which you put in there. You put all that time, effort, and strategic growth into it. That's money you get to save. So a small investment up front, heavy cost on the back end. When we talk about the impacts beyond the fines, there's many. One is operational disruptions. This episode of the Compliance Leadership Lounge is brought to you by Ronan Healthcare Consultants. At Ronan Healthcare Consultants, we believe in transforming healthcare compliance from a checkbox attitude to a strategic advantage. With decades of expertise, our team of consultants provides innovative solutions tailored to your organization's unique needs. We don't just help you meet your standards, we elevate your business, ensuring ethical practices are at the heart of what you do. Whether you're navigating complex regulations or seeking to enhance your compliance strategy, Ronan Healthcare Consultants is your partner in achieving excellence in healthcare compliance. Ronan Healthcare Consultants, redefining compliance, empowering leadership. Visit us at www.ronanhc.com to learn more. Now back to the show. If something happens where there's an investigation, you have legal issues, you have legal battles, you have, let's just say there's a civil investigative demand that comes at you from the United States Attorney's Office or the Department of Justice. There's a lot of work that goes into that, including legal fees, legal battles, holding all emails, holding all communications that have went out, storing those to preserve evidence. It can really disrupt what the operations are doing, and it becomes a huge distraction on what is going on, right? When you get an enforcement action, the operational disruptions of it are tremendous and people lose focus. What about the long-term consequences? The ability to operate in the healthcare sector, if you have excluded individuals, if you're on somebody's radar, they're going to continue to come after you. They're going to continue to look at you with a microscope over and over again. So the long-term consequences are tremendous as well. Additionally, reputational damage. If you're a healthcare organization, you might have patients out there. If you're a physician practice or a management services organization or a physician corporation, you might have reputational issues where patients go, "Ooh, I read about you in the paper," or, "Hey, by the way, you're trying to have a contract with a hospital or you're trying to do a negotiation with another healthcare entity." They go, no, I have seen what has happened to you before, and therefore I don't want to do business with you. We see a lot of this when it comes to cybersecurity. If there's breaches, if there's phishing issues that have caused some sort of malware attack or a breach in protected healthcare information, we see that people get tarnished, their reputations get tarnished. I know when I'm talking about somebody and having a conversation with board members or CEOs, and they say, "Hey, by the way, we want to contract with this EMR, we want to contract with this other entity who's going to use our patient's PHI to better serve," I go, "Whoa, let's make sure that they haven't had any cybersecurity attacks because they didn't set up their HIPAA security infrastructure well enough where they can prevent those matters from happening." And once you have a leak and once you have malware where it shuts down your EMR and they hold it hostage, then you really can suffer extreme reputational damage, because under HIPAA, if you have an exposure greater than 500, you have to post it on the website, you have to post it on your website, and you have to report it immediately to HHS. Fines are money, criminal penalties, people go into jail. The impact of everything else associated with fines and penalties and being an investigation without having a compliance program can be tremendously impactful as much as money. So how do we mitigate the risk and embrace compliance? A lot of compliance departments are really in this reactionary manner. Let's just say, "I get that, Ross. I understand it. I'm going to put in a compliance program. I'm going to invest. I'm a CEO. I'm a board member. We're going to invest in this compliance program. We're going to spend what it needs to spend. We're not going to overspend. We're going to spend right where it needs to be on a reasonable basis." And we're going to set up the committee structure. We're going to set the reporting structure. We're going to set the audit profiles. We're going to do all the things that we need to do to have an effective compliance program. One thing that's really important, and this really resonates with the Department of Justice guidance back from 2022, is that it must do something. It must actually try to be proactive in preventing things from happening. Can we prevent everything from happening in the compliance program? Absolutely not. I wish we could, but we can't. What we can do is put controls into place so that the powers that be, the boards, the CEOs, the leadership of the organization understand that we are doing our best to make sure that we catch these things. And the government should, most of the time, in my experience, and I've been a part of these, will give you credit for doing the right thing. If there is a employee, a company that's on a frolic of their own, they have disregarded your compliance training, they have disregarded your advice, then the company gets credit for having that effective compliance program. But that compliance program, in order for it to be effective, must be proactive. Reacting to things happening is not trying to prevent them. It is just trying to mitigate them. 3 standards in compliance world: prevention, detection, and mitigation. Those are the 3 pillars that we live by. Those are the 3 mantras that we have to do. And prevention and mitigation all come together, but you got to start with prevention. And that is being proactive. And detection as well, because you can't understand what's happening until you start detecting, you start auditing, you start asking questions, you start doing your risk assessment, you start giving that information to your executive compliance committees or your boards of directors and say, these are the exposures, these are the things that I want to go dig into to ensure that we are okay. As opposed to, these are the 10 things that happened last month because we weren't looking out for them and we didn't have enough information to say, we're going to go get them. We're going to be reactionary no matter what, happens all the time. But tacking on those proactive measures are extremely important. Asking the right questions, risk assessments, work plan documents from the OIG, creating your own work plan, reviewing your audit findings from prior quarters and anticipating what you're going to see in the future, doing data analysis as it relates to your CPT codes, the claims that you're billing out. Remember I said False Claims Act, $2.6 billion coming out of the False Claims Act. Understanding what you're looking for on a go-forward basis as opposed to this just happened is really important. Next, to mitigate risk, leadership. The leadership is really important. This is where we transition from a compliance officer to a compliance executive. And every leadership within an organization, whether it's a board, a CEO, whomever, wants to see effective compliance leadership. And that is not being reactive, that is being proactive, that is solving problems, that's giving me as a leader of the organization the information that I need to be able to help enforce a culture of compliance from the top levels of the organization. Once the compliance executive is able to communicate with their executives, their CEOs and their boards, then those 2 individuals, CEO and the board, can lead from the top down, can say, yes, these are the things that we need to do. Yes, these are the actions that need to be put into place. These are this infrastructure that needs to happen. And once you have that culture of compliance from the top, it's going to be much more effective to mitigating those risks. We've had lots of organizations, and I've been very lucky. I've actually had a hodgepodge. I've had an organization before when we had consultants come in. I was a new compliance officer. We had consultants come in because the company wasn't doing very well. I was a compliance officer of one, and we had a lot of work to do. I found myself being very reactionary to things that were going on. As a new compliance officer, I was a new grad too from law school. I'd been a nurse for a while, but then I was also a new grad from law school. And walking into this situation, and I really liked my CEO before. By the way, the company was under a corporate integrity agreement. So that was a fun experience. Walking in and going, wow, my first compliance officer job. This is great. How about a CIA? But what I really enjoyed, our CEO, he really was committed to compliance, really wanted us to dig into everything that we needed to dig into and provide responses accordingly, gave him lots of information. We had a seat at the board, we had conversations. But when the company started not doing well, they brought in a consultant. And the consultant immediately, what happens with consultants? They fire all the leadership, CFO, CEO, COO. I remember putting together my budget because I felt like it was the right thing to do. And I said I just needed some administrative help. And I needed someone to help me put in compliance contacts, help me run the audit program, help me do all of these things. And he said, I don't give a shit about compliance. I'm here to turn this thing around. You just need to do your job, go away. You'd be lucky if I don't drop your salary or terminate you too, because I don't care about compliance. I immediately said, okay, well, that's unfortunate. I then ended up resigning from that organization because I have this tolerance level where I am not going to put myself at risk. This was even a baby compliance officer. I was not going to put myself at risk. I remember that day that I told the board member, my chairman of the board, that I felt that way in the conversation. And I don't think I have ever been chewed out more than that conversation with the board member who said, your first obligation is to come talk to me, because if you're not being supported by this CEO, by this new individual, we need to do something about it. I'm very disappointed in you for not coming to me first before resigning. He let me resign anyways because he should have, because I did the wrong thing. But I then went to an organization that had its issues, had its corporate integrity agreements, but the leadership, which was relatively new, the CEO that had just come in to help turn it around, was so committed to compliance. General counsel was extremely committed to compliance. Parent company was extremely committed to compliance. I walked into this door with coming out from an individual who said, I don't care, get out of my office, to, yes, come in and let's put some proactive measures in place. And this, like I said, this company was not without its warts too, right? Had its corporate integrity agreements. But as we set up the infrastructure, as we developed that compliance program, it truly strengthened what it needed to be as a compliance program. What we saw was a very interesting reaction from the Office of the Inspector General, because we had monitors and everything else. They began to rely upon us to be the experts in the industry to say, hey, by the way, do it like they do it. Not like these other people, and they're still enforcing actions and causing penalties or whatever, but they would turn around and go, oh, you guys are on it? You guys are running this program? You guys have another one? We got it. You guys are going to figure it out. You guys have a great compliance program. You have a great mentality. We talk to you all the time. You become the gold standard. You become the benchmark for it. OIG is never going to give you a gold standard. They're never going to say, hey, follow these individuals. But in conversations with them, you know that they're the ones that they're relying on. And they wish every compliance program could be that way. So turning it around, becoming the best of the best, being proactive, showing your expertise on the compliance perspective is huge, and it will have a great reputation in the future and reduce those risks. How do you move forward? What are the strengthening the efforts of a compliance program? Well, first and foremost, if you have a compliance program, always improve it, always look at it, always do a risk assessment, a gaps analysis, an effectiveness review on your compliance program. CEOs and boards of directors are remiss to say, I do not want to spend 50 to 100 grand or whatever, 75 grand, whatever it may be, to come in and do a risk assessment and a gaps analysis on my compliance program. You should at least do it every 2 years. If you look in a lot of these corporate integrity agreements, especially the ones that I've been a part of in the past and the ones in the future, all of them require some sort of third-party effectiveness review to come in to continuously improve the program. It needs to evaluate itself. And like I said, a compliance program is a living, breathing thing. You strengthen your compliance program as it goes on with continuous improvement. I, as a compliance executive, look at myself and I continuously see, where did I fall apart? Where did I where did I have a gap in my performance? What didn't I say right to the board? What didn't I look at? Continuous improvement as an individual, as a compliance officer, as a compliance leader, and the compliance program will always help it enhance and get better and better. Compliance is not just the compliance department. A lot of people think that I have a compliance department, we just wind it up and let it go. Compliance is the thing that is embedded within the rest of the organization. Everybody should have a part of compliance. I've talked about the big C versus little c. Big C is the compliance program, the 7 elements, what you should do under the Affordable Care Act and False Claims Act and fraud, waste, and abuse. Those are the things, the 7 elements that you need. And little c is the compliance with all of the above. When you implement your compliance program, one of the things that's most important is this executive compliance committee, because it puts all the leadership with the dog in the hunt. Nobody cannot participate in what's happening here, nor can they put their head in the sand to ensure or to make sure that they're not culpable for anything. They need to be a part of it. So the entire organization, that leadership needs to be on your executive teams, and then you should have subcommittees underneath that with billing and coding or contract review, physician compensation review, conflicts of interest. Everybody working together. That's how you get 1 to 5 people in your compliance department as opposed to 15 to 20. That thing is not enforcing it. Everybody else is enforcing it with the overarching guidance from the compliance program. We talked about being proactive, looking in the future, speculating on what may or may not happen. I wish we all had a crystal ball. I wish we knew what the regulations were coming out. I wish we knew how they change coding and billing guidelines or the anti-kickback statutes or the safe harbors, all of those things. I wish we knew that. But we still have to anticipate that. Looking ahead, speculating, looking for opportunities to improve the compliance program so that it can help a company be strategic and grow is really important. Again, I cannot emphasize more. If you are a compliance executive with the ability to make decisions and make change, if you're a board member, if you're a CEO, I would highly recommend you put an effectiveness program review. There's lots of companies out there that do it. A risk assessment on your compliance program. It's going to do nothing but A, tell you where your gaps are, B, how to fill those gaps so that you have this effective program over and over and over again. Highly recommend it. Please go out and reach out to your nearest consultant, law firm, whomever it may be, to see what you can do from a compliance effectiveness standpoint or a risk assessment. I appreciate everybody listening today and talking through these critical issues of compliance in healthcare. As we started off, the cost of compliance is nowhere near the cost of non-compliance. And understanding and mitigating the risks of non-compliance will only protect and advance any healthcare organization, their growth factors, and where they want to go in the future, as well as keeping the money that they rightfully have deserved and they have earned for it. You don't want to give back everything that you have just because you did things wrong, you didn't know about it, or you haven't put in the efforts to make sure that you can protect the organization. Please share any experiences that you have, obviously within reason. I don't want to know about different organizations or any specifics, but any compliance challenges that you have, successes, anything that can lead to this conversation. Really want to get people's perspective so that they understand how important a compliance program is and the fact that yes, it's a cost. Yes, it has some cost to it. It has some expense, but the ROI on it, although may not be measurable in dollars and cents on the average, it is tremendous when we deal with all the other aspects of not just civil monetary penalties, criminal penalties, but reputational harm, reputational risk. So please provide some feedback. Love to hear it. Subscribe to us, share this podcast, and let's get the word out because we want to build these effective compliance programs bigger and better every day. Thank you for spending your time with us in the Compliance Leadership Lounge. I'm Ross Ronan, and it's been an honor to host today's insightful discussion. If you've enjoyed our conversation, please subscribe, leave a review, and share this podcast with your network. Your engagement helps us continue to bring in-depth and influential content in the world of healthcare compliance. Stay tuned for our next episode where we further explore the leadership dynamics and compliance. Until then, remember, effective compliance is about leading with integrity, and leadership is about making a difference.